بسم الله الرحمن الرحيم. الحمد لله رب العالمين. اللهم صل على محمد وعلى آله وسلم. أقدم نفسي محمد اسماعيل عبد الله، بكالوريوس طب وجراحة الفم والأسنان، ماجستير طب أسنان وقاية. تدريسي في كلية طب الأسنان جامعة الانبار. The previous lecture كانت حول Epidemiology of periodontal disease and indices used for assessment of periodontal disease. Our lecture today about the epidemiology of dental caries and indices used for assessment of dental caries. Dental caries. Dental caries is defined as a progressive, irreversible microbial disease affecting the hard dental tissue or the hard part of the tooth exposed to the oral environment. The hard part of the tooth is enamel, dentine, and cementum, resulting in demineralization of inorganic compound and dissolution of the organic compound, thereby leading to the cavity formation or carious lesion. The relationship between diet and dental caries, bacterial enzyme with the fermental carbohydrate lead to the acid. Then bacteria cause fermentable to the carbohydrate lead to the acid formation. The acid with the enamel surface lead to the dental caries or cavitation. إذا لابد من وجود الدايت مع البكتيريال انزيم. الدايت هو الكربوهيدرات يحول الكربوهيدرات إلى أسيد like lactic acid with the enamel surface lead to the dental caries or carious lesion. Dental caries also known as tooth decay or a cavity. Caries is a biofilm-dependent disease, bacterial in origin, that cause demineralization and destruction of the hard tissue of the teeth. The hard tissue of the teeth, enamel, dentine, and cementum. It is a result of the production of acid by bacterial fermentation of food debris, accumulation on the tooth surface, especially on the occlusal surface of the posterior teeth. This picture shows the carious lesion on the gingival third of the tooth, or cervical third of the tooth. There are two types of dental caries: acute caries and chronic caries. Acute caries يكون deep, severe pain and yellowish in color. Chronic caries يكون dark in color, brown to the black color, painless. If demineralization exceeds saliva and other demineralization factors, such as from calcium and fluoride toothpaste, these ons hard tissue progressively break down, producing dental caries, cavities, or carious lesion, that is holes in the teeth. إذا الديمينراليزيشن يتكون عندما يسبق السلايفا أو يسبق الديمينراليزيشن فاكتور like calcium or fluoride test. Today, caries remain one of the most common diseases throughout the world. Cariology is the study of dental caries. علم الكاريولوجي هو علم يختص بدراسة الدنتال كاريز. Picture show carious lesion on the occlusal surface of the posterior teeth. The earliest sign of a new carious lesion is the appearance of chalky white spot on the surface of the tooth, indicate an area of demineralization of enamel. This is referred to as a white spot lesion, incipient carious lesion, or microcavity. إذن early sign of new caries هو incipient carious lesion on the enamel surface with the white color or chalky white spot on the tooth surface. Current trend in caries incidence. In developed countries, caries prevalence declined in the last decade due to multifactorial, like using of communal water fluoridation. استخدام communal water fluoridation is very important in the community. لأن الفلورايد cause the reduction of the dental caries. Communal water fluoridation, 1 part per million concentration of the fluoride in communal water fluoridation cause the reduction of dental caries without dental fluorosis. إذا في الدول المتطورة شافوا إنه prevalence of dental caries decline بسبب استخدام communal water fluoridation. Also, in developing countries, increase the prevalence of dental caries. This is due to increase using of refined carbohydrate. إذا استخدام refined carbohydrate أيضا تسبب increase of the prevalence of dental caries. Caries susceptibility of individual teeth. هنا نشوف prevalence of dental caries among teeth. upper and lower first molar, high percentage of dental caries, 95. upper and lower second molar, 75%. upper second bicuspid, 45%. upper first bicuspid, 35%. Lower second bicuspid, 35%. upper central and lateral incisor, 30%. Upper cuspid and lower first cuspid, 10%. Lower central and lateral incisor, 3%. Lower cuspid, 3%. من خلال هذه النسب نجد أن الأبر واللور فيرست مولار هو is high prevalence of dental caries. This is due to accumulation of food that contain carbohydrate in the deep and narrow bed of fissure. الأبر واللور فيرست مولار يحتوي على الديب and narrow bed fissure وهذه تساعد على accumulation of the food leading to the dental caries. Teeth farthest back in the mouth are more frequently caries. دائما الأسنان الخلفية يكون بها more frequently caries وهذا بسبب the accumulation of the food on the occlusal surface or between the teeth. Caries susceptibility of individual tooth surface. أكثر السطوح اللي يصير بها تسوس هي الاوكلوزال surface followed by mesial surface, buccal surface, then lingual surface. The more surface affected by dental caries is occlusal surface. وقلنا السبب هو بسبب present of deep, narrow bed and fissure that التي تساعد على ال accumulation of the food on the occlusal surface. Now talk about the etiological factor of dental caries. الفاكتور التي تسبب الdental caries. Dental caries is a multifactorial disease in which there is an interplay of three principal factors. إذا وجود ثلاث عوامل من خلالها يتكون الdental caries. إذا فقد أحد هذه العوامل لا يكون هناك كاريز. Number one, the host, teeth, saliva. Microflora, اللي هو البكتيريا, Streptococcus mutans or Lactobacillus bacteria. Substrate diet, اللي هو الكربوهيدرات. In addition, the fourth factor, time must be considered. إذا إضافة إلى هذه العوامل الثلاثة نضيف عامل آخر وهو عامل مهم، عامل الوقت. This picture shows dental caries is a multifactorial infection disease. Caries يتكون by cariogenic susceptible tooth surface, cariogenic bacteria قلنا Streptococcus mutans or Lactobacillus, dietary fermentable carbohydrate especially sucrose. Etiological factor in dental caries. Number one, الهوست فاكتور. الهوست فاكتور ينقسم إلى قسمين، التوث والسلايفا. يجب احنا أن ندرس التوث اللي هو الهوست فاكتور، ندرس الكومبوزيشن of the tooth, morphological characteristic of the tooth, the position of tooth. All three components affect the formation of dental caries. Composition of the tooth. Enamel contain inorganic 96%, organic and water 4%. Dentine, organic matter and water 35%, inorganic 65%. Cementum, inorganic 45 to 50%, organic and water 50 to 55%. من خلال هذه النسب لهذه للإنامل والدنتين والسمنتم نجد أنه الإنأورجانيك 96، الأورجانيك 4. بالنسبة للدنتين الأورجانيك أكثر من الإنامل، ولذلك هذا يطرح سؤال why the dental caries in dentine more than enamel. والجواب هو أنه بسبب الأورجانيك matter in dentine more than in enamel surface. إذن the composition of the tooth affect the formation of dental caries. The morphological characteristic of the tooth. Feature predisposed to the development of dental caries is presence of deep narrow occlusal fissure, buccal and lingual bits. إذن the morphology of the tooth surface affect in develop dental caries. The presence of bit, deep and narrow bit and fissure تساعد على the formation of the dental caries. ولذلك نحن عندما نستخدم الفلورايد when used systematically affect the morphological of tooth surface, give shallow bit and fissure roundation in the cusp that make the area more cleansing. Tooth position, موقع السن أيضا له تأثير in the formation of the dental caries, which are multi-line, out of position, rotate or otherwise not normally situate, may be difficult to clean and tend to favor the accumulation of food and debris which subsequently lead to the dental caries. إذن الموقع الغير طبيعي أو abnormal position للتوث، هذا يساعد على منطقة تكون difficult to clean، بالتالي تساعد على ال accumulation of food وخصوصا الكربوهيدرات and then lead to the formation of dental caries. Saliva. Saliva also has effect on the developing of dental caries. ندرس the composition of the saliva, the pH, quantity, viscosity, antibacterial factor of saliva. The composition of saliva. Saliva contain inorganic positive ions like calcium, magnesium, potassium, negative ions CO2, chlor, fluor, phosphate, thiocyanate. Organic carbohydrate like glucose, lipid, cholesterol, lecithin, nitrogen, nanoprotein like ammonia nitrate, amino acid, protein, globulin, mucin, total protein, miscellaneous peroxides, enzymes as carbohydrates, protease, and oxidase. All these components present within the composition of the saliva. The pH of saliva determined by bicarbonate concentration. pH increase with the fluoride. Normal pH 7.8. When the pH of the saliva decrease to the 5, this is called critical pH, make the pH of the oral cavity acidity and lead to the formation of the dental caries. Quantity of saliva. Normal quantity of saliva 700 to 800 ml per day. كمية السلايفا اللي تكون في اليوم تقريبا من 700 إلى 800 مل الكوانتيتي for person. In case of salivary gland aplasia and xerostomia, in which salivary flow may entirely lacking, resulting in rampant dental caries. طبعا إذا تكون الماوث dry xerostomia dry mouth no saliva، إذا البي اتش هيكون قليل حامل environment of the mouth acidity leading to the dental caries. The viscosity of saliva. The prevalence of dental caries increase with the increased viscosity of saliva. Thick mucinous saliva increase the prevalence of dental caries، وهذا بسبب انه يكون washing of the saliva يكون قليل، بالتالي راح يصير accumulation للفود على tooth surface and lead to the dental caries. إذا السلايفا لها تأثير مهم على الفورميشن of the dental caries. كلما كان الفلورايد، كلما كان البي اتش قاعدي، كلما انه يمنع prevent developing of dental caries. كلما كان الفلورايد قليل والبي اتش اقل، يعني الاسيد الماوث يكون acidity lead to the developing of dental caries. The second factor in dental caries, an agent. The most common cariogenic oral flora is two types of bacteria, Streptococcus mutans and Lactobacillus, produce an acid that causes the destruction of inorganic compound of enamel and dentin. Third factor, diet. The cariogenic bacteria produce and secrete the chemical substance organic acid from the fermentation of carbohydrate, which may cause demineralization of tooth. The fourth factor, time. on the diet is rich in suitable carbohydrate. That the caries can be begun within days of tooth erupting to the mouth. Frequency of exposure to the cariogenic environment. إذن الetiological factor in dental caries 4 factor. الهوست tooth saliva, الايجنت اللي هي البكتيريا streptococcus and lactobacillus, الدايت especially carbohydrate like sucrose or glucose, التايم. Factors affecting caries prevalence. Age. Dental caries essentially is a disease of childhood. The mean of DMF, decay, missing filling, increase with the age because it accumulative disease. Gender. It is higher in female than male. Could be explained in children by early eruption of the teeth in female. إذا ليش إنه الدنتال كاريز عند الفيميل أكثر من الميل due to early eruption of the teeth in females. Race. People living in different geographical area having different caries incidence. In Africa and India enjoy greater freedom caries than European. This may be related to the use of refined carbohydrate in European area. Hereditary genetic factor. Dental caries run in the family of parents suffering from caries, although the environment factor have a great influence, but also the genetic factor contribute to the caries occurrence. Emotional disturbance. Anxiety status influence the incidence of dental caries. Socioeconomic factors. Prevalence of dental caries in many developing countries are increasing due to the availability of refined sugar, while the caries experience decrease in undeveloped countries. Nutrition. Malnourished people are attributed higher prevalence of dental caries. Smoking. It may be increase the risk of caries formation. Oral hygiene habit. Using of toothbrushing, dental flossing, fluoride supplement, these are reducing the occurrence of dental caries. Pregnancy and lactating. The prevalence of dental caries increase among pregnancy and lactating women due to neglecting their oral hygiene. Use of medication. Some of medication that promote xerostomia lead to the dry mouth, lead to increase the prevalence of dental caries. لأنه هذه الدراج اللي استخدمت وأدت إلى الزيروستوميا أو dry mouth, الفلورايد of the saliva قل عندنا، بالتالي الواشنج of saliva قل, cause accumulation of the food on the tooth surface, lead to the formation of dental caries. Radiation. Also, patient receiving radiation treatment increase the prevalence of dental caries because affecting on the salivary gland and cause xerostomia, and then affect the flow of the saliva, cause washing of the saliva أصبح عندنا قليل، بالتالي راح يسوي accumulation للفود على التوث سيرفيس، ومن ثم زيادة الدنتال كاريز. Now talk about the indices used for assessment of dental caries. إعادة لتعريف الدنتال كاريز a progressive irreversible microbial disease. إذا الدنتال كاريز هو عبارة عن disease irreversible أي لا يرجع إلى النورمال بعد أن تكون، فقط يعالج بالفيلينج، إما amalgam or composite filling. Progressive irreversible microbial disease affecting the hard part of the tooth. وإن الهارد part of the tooth الانامل دنتين and cement. It is the most prevalent chronic disease affecting the human race. It is usually begin soon after the teeth are erupted into the oral cavity. So it is a post-eruptive disease. It affects persons both gender, all races, all age, all socio-economic group. عندنا two type of indices. Indices used for coronal caries for primary and permanent teeth, و indices used for the root caries. Permanent teeth index using decay missing fill index DMF index, which was introduced by Klein, Balmer and Niston in 1938 and modified by World Health Organization or WHO. DMF teeth index DMFT مختصر مال decay missing fill teeth هو DMFT, which measure the prevalence of dental caries teeth. أما DMFS اللي هو decay missing filling surface index, which measure the severity of dental caries. إذا لكي نعرف شدة الدنتال كاريز على الأسنان هو يجب استخدام DMFS index. The component of DMF index is D component. D component used to describe decay teeth, which include carious tooth, filled tooth with the recurrent decay, only the root are left, يعني retained root, defect filling with the caries, temporary filling, filled tooth surface with the other surface decay. All these consider or record decay. ننطي رمز D. M component used to describe missing teeth due to caries. هاي نقطة مهمة إنه M component يسجل فقط missing teeth due to caries. أما الأسنان التي قلعت بدون أو without dental caries لا تسجل, not record. Other cases should be excluded. These are tooth that extracted for reason other than caries should be excluded, which include orthodontic treatment. هناك بعض الأسنان تقلع لأجل الأورثودونتيك treatment فهذه لا تحسب. Tooth impaction, teeth extracted due to periodontal disease أيضا لا تسجل, not record. Unerupted teeth, congenital missing teeth, avulsion teeth due to trauma or accident. All these not record as missing teeth. فقط due to dental caries record M or missing. The F component used to describe filled teeth due to caries. هاي نقطة مهمة. فقط الأسنان التي فيها filling due to caries record, other than not record. Teeth stored for reason other than dental caries should be excluded, which include trauma, fracture tooth. خصوصا هاي يصير عند الشيلدرين fracture بالسنترال انسايزر نسوي له كوزمتيك نسوي له فيلينج فهذه not record بسبب انه without dental caries. احنا قلنا فقط انه بسبب الدنتال كاريز يسجل فيلينج. فاذا الدنتال كاريز should be teeth stored for reason other than dental caries should be excluded, which include trauma, fracture, hypoplasia, enamel hypoplasia, يعني white spot on the labial surface of the teeth, سوي لها cosmetic purposes, bridge abutment for retention, fissure sealant. All these not recorded as filling, should be excluded. Note: tooth is considered to be erupted when just the cusp tip of the occlusal surface or incisor edge is exposed. The excluded teeth in DMF index are supernumerary teeth, the third molar according to Klein, Balmer, and Distin only. الملاحظة الثانية: limitation of DMF index can be invalid in older adults or in children because index can overestimate caries recorded by cases other than dental caries. Principles and rules in recording of DMFT and DMFS. In DMFT, tooth may have several restorations but is counted as one tooth filling. Tooth may have restoration on one surface and caries on other surface. It should be counted as decay. DMFS. Each tooth was scored as 4 surfaces for anterior teeth and 5 surfaces for posterior teeth. Retained root was recorded as 4 decay for anterior teeth, 5 decay for posterior teeth. Missing tooth was recorded as 4 missing for anterior teeth, 5 missing for posterior teeth surface. Calculation of DMFT, DMFS. For individual, فقط للشخص الواحد، DMF هو نجمع الديكي زائد missing زائد filling. ايش قد عندنا ديكي، ايش قد عندنا missing، ايش قد عندنا filling، نجمعها يطلع مجموع DMF. For population, mean DFF أو mean of DMF, total of DMF divided on the total number of the subject examined. عندنا الماكسيمم والمينيمم سكور. المينيمم سكور for permanent teeth بالنسبة لل DMFT والDMFS هو 0. DMFT الماكسيمم سكور 32. الماكسيمم سكور for DMFS إذا أخذنا كل الأسنان فيكون عندنا 148. إذا الwisdom excluded يكون الماكسيمم سكور هو 128. البرايمري تيث اندكس عندنا DMFT DMFS المينيمم سكور 0. الماكسيمم سكور اوف DMFT for primary teeth طبعا تميز بالسمول لتر ان برايمري تيث 20. والماكسيمم سكور for DMFS 88. المينيمم سكور للبوث DMFT and DMFS 0. DEFT with DEFS which introduced by Global in 1944. D تمثل الديكي توث. E decayed tooth indicate for extraction. F filling tooth. عندنا الأذر index in primary teeth DFT with DFS. Decay filling teeth, decay filling surface, in which the missing teeth are ignored because in children it's difficult to make sure whether the missing tooth was exfoliated or extracted due to caries or due to serial extraction. سؤال: how could you differentiate between missing teeth and due to caries? How could you differentiate between tooth missing due to caries or due to exfoliation? Other question: how could you differentiate it between tooth missing due to caries or due to orthodontic treatment? Root caries index, which was introduced by Caries in 1979. Root caries index is based on the requirement that gingival recession must occur before root surface lesion begin. Therefore, only teeth with a gingival recession are examined. All teeth are examined in both lower and upper arch. To obtain the root caries index, each of 4 surfaces, the mesial, distal, buccal, and lingual, of root are examined for a single tooth. When multiple types of root surface are exposed, the most severely affected root surfaces be recorded for that tooth. هذه المعادلة لقياس الروت كاريز index. Number of the root with the caries زائدا number of the root with the filling divided on the number of the root with the decay زائدا number of the root with the filling زائد number of the sound root مضروبة في 100 طلع لنا قيمة الروت كاريز index. Thank you for listening. إن شاء الله موعدنا في محاضرة لاحقة.